This program was Letters and Politics with Mitch Jeserich, heard Monday through Thursday at 4 p.m. here on WBAI. Stay tuned for Behind the News Long Island. Once again, this is WBAI New York, 99.5 FM and WBAI.org on the web. It is 5 p.m. Stay tuned.
More than 500,000 Americans with serious mental illness are falling through the cracks of a system in tatters. The mentally ill who have nowhere to go and find little sympathy from those around them often land hard in emergency rooms, county jails, and city streets. The lucky ones find homes with family. The unlucky ones show up in the morgue. Liz Szabo, USA Today. This is Behind the News Long Island. It's time.
Check. Hey, yo, it's time. Hey, yo, it's time. It's time. Hey, yo, it's time. We interrupt your programming to bring it to you live from the front lines. Strong animated gangs fleeing one time. Police is brutal like the streets is. Let my speech increase the peace through your speakers. Our weakness, of course, is division. Caused by religion, race, poor, be in prison. Way more than the rich ones. The laws of the pawns for position. My flow exposed flaws in the system. Look, you can't afford to be a bystander. Behind the news, where the lies die, we strive for high standards. The real power's in the hands of the people. Politics, propaganda, it's all see-through. And that's word that serves. The time is now. For the youth in our boots, gotta stand our ground. Listen Tuesdays at 5. Tune in to 99.5 East Ways. Reporting live behind the news. Radio will break from the norm as we advocate for change and reform. Behind the news, unifying while exposing the counterfeits. It's the new voice of empowerment. Behind the new platform for the people it serves, where the truth in your speakers emerge. Behind the news, where politics meet their limitations. You get the real, never imitation. Behind the news, it's time, sweet. It's time.
Buenas noches, familia. Good evening, family. Welcome to WBAI Behind the News Long Island. I am your host, Sergio Argueta, Serge. And thank you so much for tuning in to 99.5 FM. There is no doubt that without you, there is no us. This is the hour we dedicate to getting together on a weekly basis and discussing issues that you think are important, those issues that you email us about, that you send us Facebook messages about, things that, of course, we listen to because we are your voice and you are, in turn, are ours. Please make sure you follow us on Behind the News Long Island. On Facebook, the handle is Strong Surge, and on Instagram, let's make sure we stay connected. There's so much to talk about, so much going on. I want to send my prayers and my thoughts out to the brothers and sisters in Baltimore. Hopefully, there'll be some sort of resolution soon that brings the violence to a halt. Most importantly, may we identify the root causes of those issues that are causing such frustration. Next week, we'll talk about the Baltimore issue, the coverage, the causes, and what we should do about the violence that's going on, and really identifying from an activist perspective, from a pragmatist perspective, where we can go from here. Tonight, however, we're talking about mental health. We're talking about how we care for the most vulnerable across Long Island and New York State. The agencies that care for the most vulnerable are shutting down specific programs in communities, particularly with the highest need, and our agencies are shutting down permanently. We've seen a number of agencies fall victim to a mentality that fails to recognize the connections between strong mental health services, safe communities, and the health of families. As a result, so many lives of our children, adults, and families have nowhere to turn to. But before we start tonight's discussion, let's get some news updates with Linda Perry.
For WBAI News in New York, I'm Linda Perry. The mainstream media has been reporting that violence has gripped Baltimore, this after the death of 25-year-old Freddie Gray while in police custody. But what about unanswered questions relating to his death? Why was he shackled and dragged into a police van? Why is the 25-minute timeline missing of what happened to Gray while he was in that van? Why was he not given medical attention when he repeatedly called for help and couldn't breathe? Why was his voice box crushed, his spine severed? And are the police using a cover-up when they say it may have been a rough ride without a seatbelt that contributed to Gray's death? These are questions the people of Baltimore want answered, and they're questions people in New York also want answered. According to Brooklyn Council member Jamani Williams, the focus needs to be on the underlying causes.
It's easy to talk about the violence. It's easy to talk about the response to a lifetime of feeling unheard. That's the easy thing. The other questions you're asking are harder to respond to from just that one case and even in a systematic way. But those are the questions that we have to answer. When we answer those questions, I think the violence will take care of itself. I do want to make sure I'm clear. I'm not promoting that. I want that to stop. The property destruction, the violence, I don't think that it's going to help us get to where we need to go. And the same token, we have to answer those other questions. That's what people are responding to. If those things didn't happen, this response in a way that I think is destructive wouldn't happen also. But what we have are people who like to focus on the response, particularly when it's these same communities that have been systemically ignored for such a long time.
And what are you hearing in Brooklyn? What are you hearing in your communities?
I mean, everybody's talking about what's happening in Baltimore. Everybody's talking about, can it happen here? And it can happen anywhere in USA, as far as I'm concerned. I'm thankful that it hasn't happened in the same way in New York City. And I think a lot of that has to do with how we've tried to respond to this. And actually, although there was criticism, the way that people were allowed to express their voice without feeling that they couldn't. And so I think all those things were helpful. But make no mistake about it, I think no one is immune in this country. And the way to get to the remedy is to ask the question, answer it, and provide proper responses to these communities that have been, I think, intentionally ignored for such a long time. And those communities look the same across the country, and they deal with the same issues across the country. You pick any statistic, and they'll be similar.
According to the council member, the focus on the violence and property damage in Baltimore is a distraction.
People have to understand that they are responding to something. Let's talk about that something. It's easy for people to talk about what's happening. Obviously, it shouldn't be happening in that way. Okay, when it stops, have you answered the question? Have you responded to what really is at the root of the problem? So then it's going to happen again, and we're going to have these cyclical conversations. Let's finally do it.
City Council Speaker Melissa Mark Vividito agrees.
I'm very saddened about all the violence that is occurring. I think it is, unfortunately, an incredible distraction to the real conversations that we need to have about reform and about the systemic injustice that exists within the criminal justice system and policing efforts in other parts of this country. So it's really, really tragic moment right now.
This evening, the Stop Mass Incarceration Network is holding a rally at Union Square to stand with those in Baltimore in their struggle for change, their struggle for the truth in the death of Freddie Gray. Linda Perry, WBAI News, New York.
The song is called Help Me by the Beatles, and help me if you can. I'm feeling down, and I do appreciate you being around. Help me get my feet back on the ground. Won't you please, please help me? Tonight, we're talking mental health. For those of you tuning in for the first time, you're on Behind the News Long Island. We're talking about the lack of humanity and the way we approach mental illness in the U.S., and honestly, the assault that's currently taking place by way of cuts to safety nets that truly keep not only the individuals in need of services healthy, but our communities and our families safe. Tonight, I'm joined by two panelists, one here in studio, another one via phone. These are individuals that are on the front lines, and among them have well over 70 years of experience in the mental health profession. They're doing some outstanding work, leading two great organizations on the island. Joining me in studio is Andy Malakoff. He's the executive director of North Shore Child and Family Guidance Center in Roslyn Heights. He's been an editor of the journal Social Work with Groups since 1990. He's taught as an adjunct professor in schools of social work throughout the New York region, and he's been widely published and has lectured across the U.S. and Canada. Joining us via phone is Dr. Jeff Reynolds, who's the executive director of FCA, the Family and Children's Association. Prior to joining FCA, Dr. Reynolds worked for LICAD, the Long Island Council on Alcoholism and Drug Dependence. He holds a bachelor's degree in psychology from Dowling College and a master's in public administration and a doctorate from Stony Brook University School of Social Welfare. I should also mention that Andy Malakoff, a great friend, is also a social worker by way of profession. I'm honored to call both of them friends, supporters, mentors, advisors, and we're excited to get the conversation started. Andy, I'll start with you. There's an estimated 10 million people who suffer from mental illness in the U.S. The cost is staggering. We can't ever put an actual, amount on the impact that it has on society and families and communities. More and more, the cuts to the mental health service system seems to be, universal in terms of whether it's through the executive or the legislature. A number of these individuals are balancing budgets on the backs of the most vulnerable. What does it mean to those who are dealing with mental illness and their families? Just as important, how does this impact every person who might be out there just listening to this right now?
Well, Sergio, thanks so much for inviting me and giving us the opportunity to shed light on this really horrible situation that has emerged. And when you think about someone who has a mental health problem and you put it next to someone that has a physical health problem, what we're looking at, as a parent, for example, with a child with a mental health issue, there's no hesitation if a child is diagnosed with cancer or diabetes or some other kind of physical illness. But when it comes to a mental health problem, there's shame, there's stigma associated with it. There's not the sympathy and support that's associated with a physical health problem. And so parents who are looking to find help for their children are finding it difficult even to make that first phone call to ask for help. It could take days, weeks, months, even a year. And what happens when you make that first phone call and that phone is slammed down on you and you find out that you can't go because that organization doesn't accept your insurance? Well, this is happening more and more across New York State. The State Office of Mental Health, the Governor's Office, the State Office of Health, all work together in a way that what's happening at this point in time is that the system is Medicaid-centric, meaning anyone from the middle class or the working poor are having a harder and harder time finding help for their children. And I'm going to give you an example just to illustrate this for the listeners. Some years back, I live in Long Beach, where Serge lives, on the ocean. I like to spend my time there in the summer. And I was in the water, and someone pointed out a little cluster of girls, a little group of 3 girls that were drifting towards the jetty, towards the rocks. And without hesitation, I swam over there. I put my arms around the 3 of them. The oldest was probably about 8 or 9. The younger had to be 6 or 7. They were all trembling. Within a few minutes, the lifeguards came, and I swam to shore, and they took over. Now, just imagine this scenario. Suppose I swam out to these 3 little girls and treaded water about 4 or 5 feet from them and said, "Do you girls have Medicaid?" And what if they said, "No, mister," and then I swam back to shore? That is the situation that we're now facing in New York State. Kids are being denied services. There are restrictions to access, and this is something that has to be changed.
Jeff, this is a great opportunity to bring you in. As Andy paints the picture and lays out this narrative, why is it that we don't empathize more with this population? Why is it that we neglect this population without hesitation? As Andy mentions, individuals, if one of our children was suffering from a physical ailment, society would be upset if we did not, seek minimum care for our children. Why is it that we don't feel the same empathy for youth in need of mental health services and or adults, or our families for that matter?
I think the tendency is to revert back to that, well, it's just a phase, just, get out of it, cheer up, that kind of thing. I think if it's something that we can't see, touch, and feel in the way of a physical injury or a physical condition, then I think that we're very, very accustomed to saying, well, then it's not real. It's something that's temporary in nature. It's not that serious. Look, mental illness, along with substance abuse, and the two are connected, and I'm sure we'll talk about that in the next hour or so, continue to have a very, very significant stigma, which means that those who suffer wind up suffering behind closed doors very, very quietly. And the only exposure that the general public gets to mental illness is when someone who has an untreated mental illness winds up with a very public display of their disease. And then the world, recoils in horror. Or, in the other extreme, as we see very often with celebrities that have very public breakdowns, we kind of gather around them and point a finger, and it's funny and it's a joke and everything else. It's hard to imagine any other disease where if somebody was struggling publicly, we would actually turn that into a joke and share it on Facebook and everything else. I think for folks that have had personal experience with mental health issues or struggled to get their kid care, I think for them it becomes very, very personal. I think they understand it very well. But there's a bigger picture here for the public, and the bigger picture here for the public is that folks with untreated mental health conditions wind up in a few well-established places. They wind up in very, very expensive hospital settings, which is becoming increasingly difficult to access, period. Or they wind up in jails, or they wind up in substance abuse treatment centers. Or they wind up homeless on the street, all of which, if you put aside the human factor for a second, all of which costs us exponentially more. So if you walk through any of our local jails or state facilities for that matter, quite frankly, they have become the catch-all for folks who are homeless, for folks who have substance use disorders, and folks who are struggling with mental health issues. And that's become our key response and our chief response and our primary place to go for folks who are struggling.
When we talk about mental illness, Andy, and there are people out there that are listening, and I hear in Jeff's answer that we have sort of a laissez-faire attitude, or we kind of look at these young people that may be dealing with these challenges and we say something as simple as cheer up. Folks don't understand the impact of, say, depression or anxiety, or, and even the intergenerational issues that exist with this. For our listeners, can you describe different types of mental health issues from those that are definitely critical that we're seeing in high rates to those that may be subtle but are nonetheless connected to mental illness?
Well, I think one thing is for sure, and to bounce off what Jeff was saying, is that we have to start treating illnesses above the neck the same as illnesses below the neck. To give the listeners a taste of some of what comes into North Shore Child and Family Guidance Center to, show some of those shadings. After 9/11, we had a 9-year-old boy that came in with his cell phone, and he wouldn't let it out of his hands. And we said, what's that about? And he said, he says, every once in a while I call my dad because what if he's still alive? I wouldn't want him to be all alone. Another little guy came in after Hurricane Sandy with his hands wrapped around a large flashlight. And we said, what's that all about? And he said, the lights went out in my house for about 3 weeks, and the trees fell down on my house, and I'm just scared that the lights are going to go out again. We had another teenage girl who came in and who was cutting her arms. Cutting isn't always necessarily a sign of suicide, but it could be. And what she said was that she was cutting herself in order to lower her blood pressure, to soothe herself and calm herself down. And we saw a 6-year-old who tried to jump out a window and said that he had to do that because he feels that nobody loves him. This is a range of some of who comes into the guidance center. And what's really critical in a community-based mental health agency is the assessment and the diagnosis to determine the level of risk. Is this someone who needs to be seen immediately in a triage type of a way because of an emergency situation where their life might be at risk or they might hurt someone? Or is it someone where the issues have been festering for a period of time and it doesn't rise to a crisis situation? These are the very services that are being cut on Long Island as a result of the neglect of New York State. These are the services that required a full complement of staff members, not simply fee-for-service workers that come and go. These are services that require access on a universal basis, not on a restricted basis. These are services that cannot be packed into the hour in order to increase the amount of billables in a day. This is what we're missing right now.
Jeff, when we're talking about the issues that are unique to Long Island and New York State, we know that the barriers to mental health services are plentiful. We know, for example, that, on Long Island, location is an issue. We know that, there are a number of folks that simply don't have the resources. We know that there are language barriers. The barriers are plentiful. But we also know that a number of agencies are being impacted. Agencies that had, decades and decades of service are now closing their doors for a number of reasons. It's getting, difficult to run these organizations, to provide these services, particularly in the most vulnerable of communities. What do we do? What do we as the citizens of these areas, people that are dealing with the vacuum of these agencies shutting down and the lack of services for young people and families?
It's a great question, and we've got some experience with this, and FCA, I guess 3 years ago, made a very, very difficult decision to close down our clinics in West Hempstead and in Roosevelt. I will tell you, to this day, we are still paying for those clinics because they were so underfunded. So 3 years later, we still got $1 million in outstanding costs related to the operation of those clinics and the eventual closing of the clinics. And, I've looked through the data sheets and what disappeared when those clinics closed. And so you had literally hundreds of folks, in some cases young people, without access to any services whatsoever. And it all happened very quickly, very quietly. There was no public dialogue. There was no outcry. There was nobody, cavalry rushing in to say, hey, we can do this and we can do it in a way that makes sense. And clinics are closing, and providers who are already close to the bone and laying awake at night wondering if they can make payroll the next day, are loath to pick these programs up and run with them, even though we all believe that they're absolutely necessary and critical to the continuum of care. I would also say that I think the need for mental health services related to kids is growing by the day. When you look at what's happening in educational settings, namely standardized testing and the advent of Common Core, regardless of how you feel about that, I think everybody would agree that we're putting more pressure on our kids than we ever have before. For some kids, they're going to be able to take that as a challenge and they'll perform even better. An equal number of kids are going to have a really hard time with that. We're going to see a dramatic, if we haven't already, a dramatic increase in anxiety and in depression, in mom and dad, going and getting a kid with an ADHD diagnosis, access to medications that perhaps is a good thing or a bad thing depending upon where you sit. But I will say that the pressures of everyday life for children in the past year or so have gotten progressively worse and progressively more severe. And so we do that precisely at a time when there are fewer services available. I wish, in all the discussion about Common Core and all the furor about Common Core, that there were at least some level of discussion about what this does to children and the pressure to perform and the kids who don't respond particularly well to that and what will happen to them, the whole notion of no child left behind. What happens in an environment where, kids are being pushed and pulled to opt out, to stay in, to take tests, to perform, that kind of thing. I don't believe that we're equipped to deal with even the most basic mental health issues among children. And I look at layering this on top of it, and I hope that some of the energy and some of the passion and some of the advocacy we've seen on behalf of parents and parents groups translates into saying, look, we need to look at kids not as standardized test scores, but as whole people, and whole people who sometimes suffer.
Well, I mean, what's been interesting, and I mean, both of you know, and a number of our listeners and supporters know that I've been blessed with a career in a number of different settings, and probably what's been most interesting for me being the host of this show and building here with Antonio and Reggie on a weekly basis has to do with the fact that all of these issues are intertwined, right? None of, we'd like to believe these things are they're siloed or they occur in a vacuum. But what we know is that all of these things, whether we're talking about income, whether we're talking about police brutality, whether we're talking about testing, all these different issues impact our communities in such a way where you can't examine the impact of one without the other. Right. And for those of you tuning in for the first time, tonight we're talking about mental health services and the assault, the lack of funding, the cutting, if you will, that has taken place over the last, a decade or so that has completely decimated the mental health system and the impacts that we're feeling are very serious. On the phone with us, we have Dr. Jeff Reynolds, who's the executive director of FCA, and he's been very involved in a number of different organizations on Long Island. And we also have with us Mr. Andy Malakoff, who's the executive director and CEO of North Shore Child and Family Guidance, which is also an agency doing some outstanding work. So I'm blessed to have both of you on. As we continue the discussion, one of my questions, and I'll come back to you, Andy, when it comes to what we've just heard, is we know the need is greater. We know that the stressors that our families are going through, whether it was a result of natural causes such as Sandy, whether it was the stresses that they dealt with that led to alcohol addiction or alcoholism, the turn down of the economy, the need is greater. Yet it seemed that when we needed the most is when government failed, right? So there have been a $1.8 billion worth of cuts nationally to mental health services. And I know that you've been an outspoken proponent to restoring some of those cuts. And, a number of elected officials are coming out and saying, well, look at what we've done now to restore the system. Can you tell us the impact that those cuts had and what impact this restoration of funds has had, if any?
Well, the impact of the cuts is that fewer and fewer people are able to access quality, community-based mental health care. And as I referenced before, that's particularly anyone who does not have Medicaid. Now, you live on Long Island at North Shore Child and Family Guidance Center, for example. We see about 30% of people who have Medicaid and close to 70% of people who have commercial insurance. Commercial insurance rates are substandard. They're not near what Medicaid rates are. As Jeff was referring to before, organizations have had to close down because they cannot afford to absorb the loss in seeing clients, kids, families that have commercial insurance. And then they have nowhere to turn. What the state says when I ask the question, where will these children and families go? They said, well, the marketplace will take care of them. I said, well, are you referring to private practitioners? And they said, yes. Now, if you were to take a look at the rosters of commercial insurance companies and who provide services, and then you were to actually call those providers and ask them for a mental health appointment, more often than not, you would find out that they do not work with that insurance company. And so what's happening is that there's an inadequate network of care in the private practice industry as well as among community providers because of these substandard rates. What's more is a private practitioner cannot provide the labor-intensive care that a community-based organization can. Now, when you're seeing kids who are in crisis, you're seeing kids who work with a number of different systems, schools, probation, child protective services. You need teams of staff that work together, that speak together with one another, that collaborate, and that have the time in order to deal with these more complex situations.
So the time is. Thank you, Andy, for that answer. The time is coming up on 5:31. Hard to believe we're a little bit past the half-hour mark already. We will be taking some calls a little bit later. That number is 212-209-2900. So if you're a part of one of these agencies, you are out there fighting the good fight, and you've now had to find a new place of employment, or if you've had to deal with these struggles yourselves, please, we want to hear from you. That's 212-209-2900. We'll come back in a couple minutes after this short break. Good evening and welcome back to WBAI's Behind the News Long Island. I am Sergio Argueta, Serge, your host on Tuesday evenings between the hours of 5 and 6. Where we talk about issues that are impacting the Long Island region, but the ripple effect throughout the state and throughout the nation for that matter. We're blessed to be joined by two great friends. One is Andy Malakoff. He's the Executive Director of North Shore Child and Family Guidance. And the other is Dr. Jeff Reynolds, who's joining us via phone. He's the Executive Director of Family and Children's Association. Right now, we're going to switch over to one of the phone calls. I have a good friend that has agreed to come on the phone and kind of share, a personal story. Her name is Melissa. And, Melissa, the first question I wanted you to kind of answer for our listeners is, can you tell us a little bit about your story and how mental health issues have impacted your community and your family? Sorry, go ahead.
Hi.
Hey, Melissa, how are you? You good?
Yes, I'm good. Sorry. Well, I'm going to start off, I guess, starting with what the situation was with my brother, in which, we first found out that he was suicidal when he jumped into the bay. And we actually had services then because at the time he was in high school, so we were able to get the social worker, the psychologist involved, the whole school team, so they were very helpful. But as he got older, I felt like getting services to help him were very hard.
And that's something that we see oftentimes. I think that early on there are some intervention services, more so that the school can provide and some outside services. But how did it change as your brother got a little bit older, particularly at the age of 16 and beyond that?
Well, it actually started for him. It started at around that time, 16, where, he was starting to get diagnosed, where he had his first incident. So when he was he was in school till he was 18, and they were able to provide the services. Later on in life, when, we couldn't force him to take medication, and he was on his own on taking medication, that's when it became harder. But when we asked for services, we never always got them.
Yeah, and, in preparing for the show, when we talk to individuals, we know that also becomes a challenge, particularly when you don't have access to the resources and private care. Now, I know your story, and I know that of your brothers, and I know that, there was a time and an evening where your mother in particular was worried about him, and he stopped taking his medication, and, she sought out some assistance, and, the suggestion at the time was, why don't you just call the cops? And clearly in communities with everything we have going on nationally, here you have a Latino young man who's big in size, and, there was a fear that he would get aggressive with the cops and what that could lead to. So your mother didn't call the cops, and unfortunately, it was for his own safety, no neglect, and, he ended up getting into some legal troubles. What happened as a result of him sort of getting arrested and being involved in this matter? How did this kind of dovetail into something bigger?
Well, with the legal troubles, he was incarcerated for some time. While he was incarcerated, we did, it was really hard because he wasn't getting the services that he did need. At one point, he was hospitalized, but the case is still going on. It's been 3 years later, and it's still going on. We finally got, into the mental health court after 3 years.
So it took 3 years to get into the mental health court system, and this is something that's kind of new, right, to the Long Island region, and I'm sure that Dr. Reynolds and Andy can share a little bit of more feedback on that. But during the time, here you have a Long Island resident who had some legal issues that ultimately resulted in him being transferred to Rikers Island Jail. And during that process, can you give our listeners an understanding of what that process was like, of knowing that your brother's incarcerated and you know, not knowing where he was and things of that nature? Could you share that?
Yeah, there were many times where when he would be transferred to a facility, I would go see him and they didn't have answers for me. Or, you know, medication-wise, there was times when I knew he was off and that he had not taken medication. And then, you know, I would speak to the guards, I would speak to, you know, the captain, and all they would give me was the number. I would call the number and say how he was doing, and I felt like I didn't get anything back, you know?
And
I mean, like, they weren't as responsive as I wanted them to be.
Yeah. And I can imagine that there were times also where you saw the toll, the toll that it was taking not only on your brother physically, emotionally, but even on your in your family, correct?
Oh, yeah. Well, just on him itself, I can say that the person, a 300-pound person, one time, then you go see him and he's 110 or 120. So you could see what it did to him.
Yeah.
And for us, it was miserable.
Yeah. Well, listen, Melissa, we greatly appreciate you taking the time out to join us and sharing your story, because it truly adds value to the issues that we're talking about. You know, Jeff, I'll come back to you with this. How is it that we are unable to provide these services for these people when they are out in the world, and it's actually cheaper in terms of outpatient care, providing services and helping keep, you know, these families intact, but we have all the resources in the world when it's time to incarcerate? How does that work?
The short answer, it doesn't work. And stories like Melissa's brother drive me crazy because, you know, we know more about the human brain and mental illness now than we ever have before. There are more evidence-based behavioral interventions around now. There are more pharmaceutical-based interventions now than ever before. And so when I hear a story like that, it's a missed opportunity. With the proper treatment, the symptoms can be addressed. Instead, we tend to wait till folks, you know, are into a full-blown disease process. And, you know, in this case, you wind up with somebody that's inappropriately placed into Rikers, which has no matter who you are, has a certain amount, in fact, probably a significant amount of trauma associated with it, both for him and for the family. It's costly. You've got someone who now has a criminal record, which impacts potential employment later on in life. And the shame of it all is it doesn't have to be that way. That we know how to assess folks the right way. We know how to treat them properly, but the beds and the resources aren't there. You know, in Suffolk County, you know, they're very proud of the fact that they just spent, you know, $200+ million building a brand new jail. And I've said to more than one person in Suffolk County, you ought to start on the next one, because unless you get serious about dealing with the mental health issues in our community, you're going to need more and more cells in order to provide the care that folks are not getting in other settings. Again, you know, it's a shame when it comes to the financial aspects, but it's even worse when you get to the human aspects. Look, even kids that we have in our residential programs, and we have 2 homes that are for kids with some serious mental health issues, even trained professionals trying to access care run into a long string of obstacles. You know, in the case of Peninsula Counseling Center here on Long Island that closed and actually transferred ownership within the past 2 weeks, you know, there's a physician there who told us that he's got a roster of 2,000 patients.
Wow.
There is no way that you can appropriately manage 2,000 patients. When you do the math, you know, what does that mean in terms of the time you're actually spending with that patient? And again, you know, given everything we know, it's hard to believe that we're still at this place. And I think part of the reason we're still in this place is because this is an issue that continues to exist in the shadows.
And let's, you know, and one of the things I definitely want to highlight as we have these discussions, and, you know, Andy read off, you know, the individuals that he sees, you know, we're talking about those that are at least seeking, we haven't even touched those that have absolutely no insurance, those that really have absolutely no access, those that, because of where they live regionally, can't even access services and don't have individuals with the cultural competency, if you will, to even provide these services. So the stigma, all these barriers, I mean, the layers are just, layer on top of layers in terms of what's keeping people from accessing this. Folks, if you're listening to tonight's WBAI Behind the News, we're talking about mental health. We're taking calls at 212-209-2900, 212-209-2900. So if you are someone that, if you yourself have had mental health issues and, can talk about, the difficulties in terms of dealing with these challenges of even accessing services, we want to hear from you. If you were out there, if you're a social worker, if you're a psychiatrist, a psychologist working in this field, and suddenly, you've been one of the casualties of this budget cutting, please let us know. And that's a serious issue, right, Andy? So real quick, Andy, I mentioned this before. It seems that regardless of what party's in charge of the legislature or any executive branch throughout, the number of bodies, they keep cutting and balancing these budgets on the back of those that need it the most. What's something that we should all be doing to really mobilize around this issue, and
well, one thing that we should do is we should implore them to demand that the insurance companies live up to the letter of the law in terms of parity. What parity is a law in New York State. It's called Timothy's Law. It was put in place some years ago after a child named Timmy O'Clair was denied services after a period of time, went home, and then hung himself. His family advocated for parity, which means that behavioral health care, meaning substance abuse and mental health, should be on par with mental health care and with physical health care. I should say mental health and substance abuse with physical health care. That's a critical issue, and they should demand that these insurance companies have adequate networks of care, or their licenses should be stripped.
Clearly, so there's a lot of mobilizing. There's a lot of work that we need to do. Caller, if you're listening, thank you for joining us on WBAI. Tell us your name, where you're calling from, what's your question, what's your statement?
Yes, good afternoon. I want to comment in terms of your discussion, which is a crucial and important discussion, first around educating the community about not calling the police with these mental health issues. I mean, when do we see that the police are the last resort? Contact the cousin down the street, come up with other strategies. Two recent cases, one in Dallas, a guy, his mother walks out, he supposedly had bipolar, is what she was saying, and he's fiddling with his little screwdriver, and apparently 275-pound white men felt threatened by a tiny screwdriver that he was just fiddling with and shot him dead. And there's another recent case. There's so many, I can't recall the details. But what I want to share is in September, and those involved in the community might want to connect because it's beautiful, in the Catskills at that time, and NYPIRG, New York State...
Public Interest Research Group.
No. This is for psychiatric rehabilitation services. NYPIRG, it's called. NYARP. It's out of Albany, NYPIRG. And there are two strains that come out, and you have both the disabled and the advocates for them, and sometimes it's a combination of both. And two strains that needs to be discussed and brought into the fore. First of all, there's a vanguard of people who are dealing with these issues without the farmers, without the SSRI drugs. We must wake up to the fact that the veterans are a perfect example. They are loaded up with them, and there's even on the inserts and the black box warnings, suicidal ideation and homicidal.
Sister, I hate to cut you off, but we have so many callers that we actually have a number of callers that need to get on. But we definitely understand that the correlation between a number of drugs that are being prescribed to individuals, the lack of clearly there's a number of things we need to do holistically to address the issue. But it's true that a number of people that are calling for assistance shouldn't call 911. That shouldn't be the response. And, you know, once you get to that, we can't control where those issues end up. Next caller, what's your name, where you're from, and what's your question statement? Please be succinct. We have very little time. Go ahead.
Hi, I'm calling, my name is Kimu. I'm calling from Hawaii.
Nice. Kimu, thank you for joining us. I have to say that's the furthest phone call I've ever gotten. So go ahead, brother.
Yeah, go ahead. Thank you, brother. I've worked with mentally ill, chemically addicted people, and I work right now for an agency in Honolulu. And I've been working with this population. I've worked in group residential adult day treatment, and it seems to be getting worse. And there was an old patient that I found out recently that was killed by the police, and I keep saying to myself, if this was a haole, a white guy, this would have never happened.
Well, listen, Kimu, we appreciate you calling us from Hawaii. Clearly the need and the challenges are everywhere, and I'm thinking that, someone here may be considering a Hawaii paradise, right? But even there, the challenges are real, and these as we mentioned, the wounds are not physical, so we're all walking around with some sort of anxiety issues, concerns, and it's important for us to understand that. Next caller, where you calling us from? What's your name, and what's your question and your statement as succinct as possible?
Yeah, real quick. My name is Bob, and I'm calling from Brooklyn. I was just sort of twisting the dial and came upon your show, and I happen to be a social worker. And
nice.
A friend of one of my kids had a friend who was looking for mental health treatment and was on Medicaid, which means the person is greatly in need, and in fact, was on Medicaid because of a mental health disability. And I went around, and so they asked me to help. So I went around, person was in Manhattan, and I called virtually every major hospital in the city, and virtually all of them had a closed intake except for former patients or for employees of the hospital. So really, the famous hospitals of New York City have very little community mental health interface with the citizenry at this point. And I think this has to do with the finances and that it is not cost effective for them. And I just found that very, very frustrating. And so I'm passing that on.
Well, listen, Bob from Brooklyn, you're talking to 3 social workers on air. Thank you so much for joining us. Make sure you spread the word and let others know. We definitely want to make sure we start talking about these issues and spreading the word. In this instance, Andy, Bob brings up, a valid point. A number of folks look at this issue, particularly, I'm talking to 2 administrators, right? CEOs, and EDs, and part of the fear, and this will be for another topic and another discussion, but clearly you're trying to keep an organization running. You're trying to make sure that balance sheet is actually balanced so that you could continue providing these services. But there's a trade-off, if you will, right? In terms of us as an administrator, if you're trying to keep your office opened, but the costs are becoming that much more exorbitant and the sustainability is not real, what do we do?
Well, one of the things you can do is fundraise, but that's not something that everyone can do, nor can you raise the amount of money that you need to. Unfortunately, some of the other steps that organizations have taken, which I've mentioned before, is to replace salaried staff with fee-for-service staff in order to save on fringe benefits. And so that's not a good answer either, because then you're eroding the culture and the quality of care, because fee-for-service workers, they're great, but they're not really a part of the organizational culture. They come and they go. And so that really puts a tremendous, tremendous load on trying to provide a community-based organization. I think also it's critical for there to be integrated services. One step that New York State has taken, which might help, is called health homes, which is really bringing together providers who work with kids that have substance abuse problems, other mental health problems, physical health problems, bringing the different systems together to work in a coordinated fashion. Now, that's also a medicated system, which is problematic, but I think getting rid of those silos that you referred to before and truly integrating care so that people like the ones that Bob on the phone mentioned won't get turned away from the hospital are critical.
And I think that, these are the realities. There's nothing worse than actually walking in somewhere, seeking that assistance, finally taking that step. And maybe you're the family member that has finally been able to negotiate this with your loved one. And now you get them in the building and, you don't have the proper insurance. You don't have the proper, resources to actually get coverage. Folks, before we let off, Jeff, can you kindly tell folks how they would get in touch with FCA, the best way to learn about FCA and what you're doing? The same for you, Andy. Jeff, go first.
Yeah, sure. Our phone number is area code 516-746-0350. And then, of course, we've got a website at familyandchildrens.org, which describes our children's mental health programs, our residential programs, and our chemical dependency treatment programs. The other real important takeaway here is we've got to begin to link these issues up. And we look at the fact that there's a substance abuse crisis impacting Long Island and virtually every other area of the country. Part of the reason for that is that marijuana, alcohol, and other drugs work really well at medicating away anxiety, depression, and all the mental health symptoms that folks experience. And so as we break down silos, we've got to understand the connection between poverty and mental health issues, the connections between mental health issues and substance abuse, the recurring trauma that some of our kids experience in their communities and at home. All of this stuff is connected, and if we get back to basics, I think we stand the best possible chance of addressing these issues all at once.
Thank you, Jeff, for that. And Andy, how can they get in touch with you?
Okay, North Shore Child and Family Guidance Center at 516-626-1971. We have a triage and emergency service where we can see you within 24 to 48 hours, which is about 36% of those that call us. We also have a website, www.northshorechildguidance.org. And I would just like to say to the listeners out there, when you hear the news about Baltimore and about other places, always keep in mind that context counts. Whatever the issues are that your children might be dealing with, that you might be dealing with, there's a whole wide world out there that impacts on us every day. The anxiety is increasing, the depression is increasing. That's what we're seeing, and that's what's out in the general population. So please take care of your kids.
Gentlemen, it's truly been a pleasure. Please, I'm sure you guys are going to be back talking about a number of different issues. For those of you that have been listening, whether you are in Hawaii, whether you're in Brooklyn, whether you're in California, wherever it is you are, we thank you for tuning in. We know that if you would not be listening to us, there would be no reason for us to actually touch these mics. The only reason we're here is because we're empowering community and really making sure that we provide a voice for those that don't have one. Thank you to my panelists. Thank you to everyone who makes the show possible. Brother Antonio Kelly, picture this. And, of course, my man Reggie Johnson behind the boards. Please make sure you tune in to WBAI Behind the News, Long Island, every Tuesday between the hours of 5 and 6. We appreciate you. Remember, one voice, one mic, one community. It's not my community. It's not your community. It's our community. And if we don't take care of it, who will? Strong Island, stand up. Peace.